I can't believe I'm saying this, but I might vote for a Democrat.
When we get our next pandemic, like we had with COVID, how would you attack that? How would you try to get the country squared away so that we wouldn't be suffering like we did in the last one?
The answer to that is I would do the pandemic preparedness protocols from WHO, CDC, the European Medical Association, the NHS, National Health Service in England, have said for decades, which is you quarantine, you don't do mass lockdowns ever. You quarantine the sick, you isolate the vulnerable, and then you look for, particularly for off-the-shelf therapeutic drugs that treat the illness. You don't lock everybody in and say you're waiting for a vaccine that is untested and that nobody knows whether it's going to work or not. You actually treat people who are sick. This is the first respiratory illness in the history of medicine where you could go into the hospital with a positive PCR test and symptomatic. And the hospital will say, there is nothing we're going to do for you. You go home till your lips turn blue, until you can't breathe, and then come back here and we're going to give you two things that'll kill you: intubation and remdesivir. Meanwhile, we're depriving people of drugs that are proven, of Zithromax, of ivermectin, of hydroxychloroquine, that were proven. The countries that use those drugs had a fraction of the deaths we did. Why is it, if what we were doing worked, why did we have the highest body count of any country in the world? We have 4.2% of the global population. How in the world did we get 16% of the COVID deaths? It doesn't make any sense. Meanwhile, nations that avoided vaccines and gave their populations ivermectin, hydroxychloroquine, and other early treatments, many of them didn't even have a pandemic. Nigeria has the highest malaria burden in the world. So almost all the population is on hydroxychloroquine. They take it once a week. It's called Sunday. Everybody takes it on Sunday. And it also has the highest river blindness burden in the world. So a large part of the population is on ivermectin. The death rate in Nigeria was 14 people per million population. The death rate in our country was 3,000 per million population, 200 times what they had in Nigeria. Nigeria had a 1.3% vaccination rate. So it wasn't vaccines that had anything to do with ending the pandemic. If you look across the board, the countries that were the most heavily vaccinated had the highest death rates from COVID consistently. Those that had lower vaccines and depended instead on therapeutic drugs did much better. In fact, there's states in India, there's a state called Kerala that adopted our protocols and had death rates similar to ours. The nearby state of Uttar Pradesh, which has 230 million people, so its population is comparable to the United States. As soon as they started giving people ivermectin, hydroxychloroquine, the pandemic ended there. What we should have done is instead of using the internet to suppress debate, to censor people, to punish doctors who are speaking out and saying, we should be using early treatments. I'm giving it to my patients and they're recovering miraculously. Those people, these doctors of conscience, were silenced. We should do the opposite. We should have built a grid, and this is what I'll do, that reaches all 15 million frontline physicians in the world, and where they report what they're doing and what's working and what's not working, and all that information then gets synthesized through AI. So we can quickly spit out to all the other practicing physicians, this is what they're doing in Bangladesh and they've eliminated it, or this is what they're doing in China or Guatemala or Central America. But we didn't do any of that. Instead, we used the pandemic as a pretext for clamping down these controls on our freedoms and to promote medications that didn't work. One of the things that people should know, the government, the people who were promoting the vaccine had to get rid of all the competitive products. And why is that? Because there's a federal law, the Code of Federal Regulations, that says that you cannot give an emergency use authorization to any vaccine if there is an existing medicine that has shown to be effective against the target disease. So that's why they had to tell us that ivermectin was a horse medication that didn't work. It's not a horse medication. It is given to horses because it works for all mammals. But it won it's one of the only products in the world that has won the Nobel Prize because it was effective for humans. It's been given in billions and billions of doses, and it's eliminated river blindness and other parasites around the world. We should have focused on things that work rather than focusing on advancing the mercantile interests of the pharmaceutical industry.
Next question.